Okay, so we continue. So we are continuing with the problem identified as altered breathing pattern. So with the with the five columns that we drew, the altered breathing pattern, like I said, you just need to copy this and paste it in the diagnosis. So we're going to have altered breathing pattern related to so if someone has got CCF and they have altered breathing pattern, mostly it's because of pulmonary edema. Okay, so related to pulmonary edema, then evidenced by, so if you have altered breathing pattern, mostly what you're going to see is either labored breathing or dyspnea. Okay, so our dyspnea, that is our evidence. Then what is our goal? So now how to write the goal? Remember, your goal needs to be SMART. Now SMART means it should be specific. So who are you doing this goal on? Then it should be measurable, it should be attainable, then it should be realistic, and it should be time bound. Okay, so I always tell my students to start with the word patient, because here you're being specific as on who you're doing this nursing care plan on. Then what you wrote on the diagnosis before the word related to, everything here, just put it here, copy and paste it again. So all patients altered breathing pattern will be improved when. So here you can't say throughout hospital stay, because this one is a cardinal sign, okay, and symptom which need to be alleviated as soon as possible. So it should be improved within maybe 30 minutes of my nursing interventions. Okay, so now what are you going to do? Here the English that you're going to use is I will. Don't write it in second person perspective. You need to write it in first person perspective. That is you doing the interventions, not anyone else. So I will. So what are you going to do? And then you give a rationale. Okay, so here you can say I will prop up the patient, or I will let the patient sit in phallus position to improve lung expansion. I will give oxygen, for example. Okay, then I will remove any tight clothing to help or enable breathing and all that. So you need to have at least 4 to 5 interventions there with your rationales. Then our evaluation. Okay, how do we write our evaluation? Okay, so what you wrote on your goal, okay, this you just need to transfer to your evaluation, and then you just change the English to past tense. Okay, so here we wrote that patient's altered breathing pattern will be improved within 30 minutes of my nursing intervention. So here we're going to write evaluation. We'll say patient's altered breathing pattern has been, okay, improved within 30 minutes of my nursing interventions evidence. Okay, evidenced by. So you need to always put an evidence whether the problem is actual or it is potential problem, like risk of pressure sores, risk of acquiring nosocomial infections. All of those need to have an evidence. Okay, so evidenced by. So our evidence here, it was dyspnea. Okay, so mostly you can put the opposite of what your evidence was here. So our evidence will be, so since if it was dyspnea, it will be evidenced by proper breathing pattern. Okay, or you can say evidenced by clear airway. Okay, clear airway, something like that. So you can either write this one or that one. Okay.